What's going on, everyone? Welcome to the Friday edition of the Pandemic Update for Friday, May 26, 2023. Hopefully, everyone's staying safe, healthy. If you had to take a COVID test, hopefully you tested negative. If you are traveling somewhere this weekend, maybe you're watching me while you're sitting in a traffic jam somewhere right now. I hope you brought these with you, the N95 mask, because I'm super concerned this weekend's going to cause a COVID big time surge across the country. Cases are rising, my friends, and I got proof why I'm concerned. I'll show you that in a minute. Let's get through the news portion of this first. India logs another 490 COVID-19 cases in 24 hours. The active case load is 5,707. Just two more fatalities today in India. All right, this is really concerning. This is a big bombshell. The CDC, remember they had an outbreak in Atlanta from a conference that they had? That has now climbed to 181. Yes, folks, not good. 181. Meanwhile, they're telling us it's fine to go to these gatherings. But look what they're telling their own people to do. The Centers for Disease Control and Prevention is advising people attending a June agency event to wear their own high-quality mask and, if possible, also carry COVID-19 rapid test. They're telling the attendees to do this, but the regular folks like you and I, they're not giving us guidance to do that. It's not mandatory. They may have recommendations, but it's not mandatory, and they're not really going on TV saying, hey, you need to do this. No, they're just quietly adding it to their guidance. All right, moving on to this. Usually we would talk about H5N1. Not today. This is H5N5, another type of bird flu. There's a lot of them out there. Canada reports an outbreak of H5N5 bird flu in New Brunswick and Prince Edward Island. American crows and a red-tailed hawk are affected. I'm not certain how this outbreak came to be there or how it ended up there. I believe, and someone put in the comments if I'm wrong, H5N5 originated somewhere either in China or somewhere in Asia, I think. I could be wrong. There's a lot of different strains of bird flu out there, and this is one we don't talk about too often. All right, moving on to our next story, and this is in Pennsylvania. This is in my state. I thought it would be good to show what the cases were, and they're a huge undercount. I'm not buying our cases at all. Department of Health cases, COVID cases in PA Valley at low levels. They're talking about Susquehanna Valley. We're not worried about the Susquehanna Valley or Northumberland. We're worried about the statewide number. The state says in the past week there were 1,051 new statewide COVID cases, which is 439 cases fewer. But as you know, as I reported on yesterday, I still got a sticky note on it, Pennsylvania hospitalizations for COVID are at 260. That is up from last week's number, which is up by 11, it says. So if hospitalizations are going up, clearly cases have to be going up. And, a lot of people don't bother to get tested. A lot of people do the at-home test, which doesn't get counted. There's a whole number of reasons. All right, moving on to this. COVID hospitalizations. New record low nationwide, CDC says. Yeah, they may be at a record low, but we got a huge holiday weekend, and a lot of people are traveling. People are spreading around, so yeah, that's going to be short-lived because we do have some places. You just saw Pennsylvania starting to rise. Ed Ames, Daniel Boone star, and Ames' brother, singer, dies at 95. So this is sad, just yet another celebrity death. Then we have this. Celine Dion puts the brakes on world tour, and it's hobbled by her neurological disorder. So she's been dealing with this for some time, and apparently it's rough. I read even when she's feeling 100%, she says she's just not able to perform. So that is really sad. All right, moving on here. Did not add a lot to the news portion today. Could I have searched and found more news? Sure, but we'll be sharing it. We'll be harping on the news portion a lot this weekend simply because there's not going to be a lot of data this weekend, the holiday weekend. States will likely take off. All right, we do have two things to report on today on this day in COVID history. This is on May 26th of 2020. Navajo officials implement a series of mitigation efforts, including extended weekend lockdowns, curfews, stay-at-home orders, masking, and checkpoints at Younger generations of Navajo begins to launch grassroots social media campaigns like Protect the Scares to provide health information, help defend their people, cultural heritage from COVID-19 to Navajo become a model for implementing a unified pandemic response. And we did have one other thing on this day in COVID pandemic history. May 26th of 2022. CDC updates the COVID-19 community level, showing that 71.52% of the U.S. population is in a location with low COVID-19 transmission levels. 20.73% have medium levels, and 7.76% have high COVID-19 community levels. Alrighty, let's take a look at wastewater, and we did get an update from wastewater. We'll do the full wastewater update on Sunday, but 129 news sites, 0 to 19% COVID in wastewater, 533. 20 to 39% is 412. 40 to 59% is 124. 60 to 79% is 21. And in the red, yeah, the high, there's now 6 sites that are 80 to 100%. And I want to quickly zoom into New York City. This is the area that really concerns me the most. New York City has a lot of wastewater sites that are rising. Here's one on Staten Island. Let's just find some more. Here's one. Let me move myself so you can see. Here's Kings County. Here's another one down here. Another one in Kings. That's starting to rise. 758,000 population. Here's another one in Kings with 1 million people. That's rising as well. The problem is a lot of people from New York are getting out of town for the weekend. Let's take a look at some traffic cameras. We've done this before. And let's take a look here. Example, Connecticut, the northbound Merritt Parkway, Route 15. They are reporting a 36.5 mile delay going northbound on Route 15. That's not including what's going on I-95. There's 16.5 miles of delays there. You can see here, delay, 16 miles, exits 10 through 25. How about New Jersey? People are on the move in New Jersey as well. Look at this. This is the Garden State Parkway, which is a major route to the New Jersey shore. Look at this. It is just as far as you can see, just a sea of traffic. And then we can come over to Pennsylvania. And people are not only coming from New York to go places. Look at the mass exit out of Philadelphia. In my area, going up on the Northeast Extension, people are going to the Pocono Mountains for the weekend. Look at this camera. As you can see here, it's just a sea of traffic. And now here's another one where people are coming from New York and Philadelphia. Look at this. You have a massive traffic jam on the westbound Interstate 80. Look at this just sea of traffic. And remember, wastewater is up. Remember, some people may have just had contact within the last few days, and they don't know that they're positive. Well, now people are spreading it. So say someone from New York goes to the Pocono Mountains and then affects someone that came to the Pocono Mountains from Philadelphia. Now they brought COVID back to Philadelphia. And say they don't show symptoms till late next week, but they go back to work on Monday and they work in an office where there's, I don't know, 200 people in the building. How many people did they infect there? This is what's going to happen, folks. We're going to see big time spread. Why? Because the XBB variants are rising. XBB.1.5 is still dominant at 53.8%. XBB.1.16, it's now up to 15.1%. XBB.1.91 is at 11.8%. XBB.1.92 is at 6.1%. XBB.2.3 is at 4.8%. XBB 1.16.1 is at 3.9%, XBB.1.5 is at 2.2%, and FD.2 is at 1.5%. The variants are on the rise. Cases are on the rise. The levels of the XBB.1.16, 2.3, and 1.16.1 are going to increase dramatically week over week. We may not necessarily see it next week. Well, we won't because they don't update this next week. They'll update it the following week. We'll likely see it by then. We'll see the effects of the holiday weekend. Let's take a look at some New Jersey numbers. New Jersey hospitalizations actually dropped to 176. That's good news. Will it last? I don't know. And let's move myself back here. And may not last because, again, holiday weekend. We won't see the effects till the second half of next week. And remember, those are saying, oh, that's too early. Not necessarily. These new variants move much faster. So the time from having contact to infection to hospitalization, it's a bit faster than what it was in the early days of the pandemic. And if you haven't had enough of the spread of what's going on with COVID, I mean, just look at the entire East Coast. Look around the country. Let's look at the West Coast. I don't want to forget about you. Yeah, LA's traveling. People are traveling all over the country. And let's take a look at today's EMS calls for Philadelphia. You can see in Philadelphia we had 675 EMS incidents yesterday. I can assure you today will likely be higher just based on what's going on in the suburbs right now. Suburbs are very busy. There's Montgomery County, 14 calls. Here's what's going on out in Chester County, Pennsylvania, a lot of calls. So, yeah, today's busy for that. All right, moving on to New York State, 535 new cases. That does not include reinfections or at-home tests. The positivity is 4.4%, and the 7-day average is 3.4%. Probably at some point next week, because they don't update over the weekend, we'll probably do a region-by-region look, because we want to see what the spread from New York City does to the rest of the state, or wherever people come from to go into upstate New York. You know, the Adirondacks, the Catskills, Western New York, Finger Lakes. Those are some popular destinations over the holiday weekend. Take a look at New York State hospitalizations, and you will see here that hospitalizations, they're holding steady. It's just a very slow increase. 581 today, which is actually a little bit higher than yesterday. 55 people in the ICU. Let's take a look at New York City, like we have been doing a lot lately, and of course this always refreshes when I go to do that. And taking a look at New York City, you can see the hospitalization number in New York City is slightly up from yesterday's 220 people in the hospital and 24 people in the ICU. Let's take a look at some international numbers briefly. Remember, it's only Memorial Day weekend in the United States, not in the rest of the world. So next week won't be lagged too much in the rest of the world. South Korea, cases down 8%, deaths up 22%. United States, we'll just say it, cases are down 40%, which honestly, at one point they were down 55%. So even that is starting to change. Deaths down 29%. Can't go by these death numbers. They are completely off. It says 343. The real number is much higher than that. Russia, cases up 49%. Deaths up 73%. Vietnam, cases down 31%. They had 5 deaths versus 1 death this week. So that is a 400% increase. And let's take a look at Hong Kong, 23% increase in deaths, or excuse me, in cases, 28% increase in deaths. Thailand, 12% increase in cases, 191% increase in deaths still. And Canada, it's saying cases are down 87%. We're not buying that because wastewater in Canada, as you know, is going up. Let's take a look at the flu numbers for this week, and I'm going to refresh this right now. It should have updated. There we go. It has come in. Puerto Rico, you are at high levels of flu still. This has been going week after week. Not certain what's going on there. New York City, you're at high levels, and Washington, D.C. is moderate to near high. Low levels in Texas, New Mexico, and in California, with minimal levels everywhere else. Alrighty, that does it for today's pandemic update, folks. We will be doing pandemic updates throughout the weekend. I'm not taking a weekend off. In fact, as stated, I'm going to be doing some maintenance on the website. Some sections are going to be getting categorized better. I'm probably going to be doing some upgrades to the COVID positive archive. I want to organize that a lot better. And on a section of the site where it says other viruses, yeah, that's getting some changes as well. There's just too many things in that section. I'm actually going to split that into a whole new category. All right, if you're traveling this weekend, again, take the mask with you and take some rapid tests with you. If you start feeling symptoms, take a rapid test and isolate. I mean, this is going to be a very risky weekend. God forbid, if you're doing any dining anywhere this weekend, at least make it outdoors. No indoor dining this weekend, please. Do not do that. This is going to be a super risky weekend. Stay safe. If you're going to barbecues, mask at the barbecues, because this is going to be, again, I'm just super concerned that this is going to be a super spreader of a weekend across the country. Alrighty, folks. Until I see you again next time, stay safe. If you like this, hit the thumbs up button. Subscribe to the channel down below. I mean, if you want to see what's going to be happening post Memorial Day weekend, I'll be reporting on it. So subscribe down below. And, of course, thanks for watching. I'll see you all again next time. I'll see you again tomorrow for another pandemic update.